How to classify cervical lymphadenitis based upon its infectious etiology. There are four types of presentations are there. One is acute bilateral cervical lymphadenitis, acute unilateral lymphadenitis, subacute or chronic bilateral lymphadenitis, subacute or chronic unilateral cervical lymphadenitis. Acute bilateral cervical lymphadenitis is the most common clinical presentation, and it's most often caused by a benign self-limited viral upper respiratory infection like enterovirus, adenovirus, and influenza virus. The lymph nodes typically are small, rubbery, mobile, and discrete. They are minimally tender and without erythema or warmth. Group A streptococcal pharyngitis is a common bacterial cause of bilateral cervical lymphadenitis, which is often tender. Second is acute unilateral cervical lymphadenitis, which occurs less frequently than acute bilateral adenitis. Here, the organisms are bacterial organisms like Staph aureus and Group A streptococcus. Although systemic symptoms of fever, tachycardia, and malaise may be present, the patient usually does not appear toxic. Submandibular nodes are affected in more than 50% of cases. The lymph node usually is 3 to 6 cm in diameter, tender, warm, erythematous, non-discrete, and poorly mobile. In older children with a history of periodontal disease, acute unilateral cervical lymphadenitis is caused by an infection with anaerobic bacteria. Third presentation, subacute or chronic bilateral cervical lymphadenitis. Here it's most often caused by Epstein-Barr virus or CME infection. EBV causes infectious mononucleosis that manifest as fever, exudative pharyngitis, lymphadenopathy, and hepatosplenomegaly. Fourth one is subacute or chronic unilateral cervical lymphadenitis. It's usually caused by non-tuberculous mycobacterial infections. Most NTM infections occur predominantly in immunocompetent children younger than 5 years of age. The presentation is they usually present as a unilateral firm non-tender node that slowly enlarges over several weeks. The submandibular, jugulodigastric, and parotid nodes are most commonly infected, and usually they are less than 4 cm in size. And lack of response to antistaphylococcal and antistreptococcal antibiotics, and Mantoux test may show 5 to 15 mm of induration at 48 hours. Thank you.